Sex is the spark that ignites many relationships. But that heart-racing enthusiasm you first have can diminish with time, and for some reason, it seems to fade more quickly in women.
So this program is about desire, female desire. Why it comes, why it goes, and what, if anything, you should do about it.
From the controversial new theory, it's monogamy that kills a lady's lust,
Female desire, after a few years, seems to quite literally plummet.
to whether taking testosterone can restore it.
They would cut my throat if I tried to take away their testosterone.
Right, okay. Looks like I'm gonna try it.
Join me as I put my hormones on the line and investigate the science behind female libido and what it takes to reignite a healthy sex life.
They're called the reproductive organs.
In a culture that used to make us feel guilty if we liked sex,
Now, we don't let anybody touch anywhere near these special parts of our body.
and now makes us feel guilty if we don't, it's no wonder some women feel conflicted about sex. But I want to start with our biology, with a hormone we've always associated with men, but which may equally influence desire in women. It is, of course, testosterone. And I'm on my way to get mine tested now.
Hi, good to see you.
Because I'm in my 40s, I have a partner, and this libido question has become a real worry in my life.
So, first off, tell me what are your concerns and what are you hoping that I can help you with?
I just noticed that I don't have the same sensitivity anymore sexually. I don't have the same responsiveness. It's like it's gone.
Okay, so what we've got now is your results from your recent blood test. So you're really healthy. But in fact, your testosterone now is on the very lowest limit of normal.
Right.
I'm in the unusual situation that I first did a testosterone story with Professor Davis 10 years ago, and my levels were taken then. So in my case, we can see clearly what's happened over time.
Your testosterone's about 30% of what it was 10 years ago. It's declined. That's not abnormal. It's a part of reproductive aging.
So why does testosterone matter? Contrary to popular belief, testosterone is vital to being female. Without it, we can't fully develop into women. That's partly because we need testosterone to make estrogen. But testosterone has vital functions all of itself. Like in men, it influences our energy levels, bone density, and sexual interest.
So if we talk about the menstrual cycle, at the middle of the cycle when a woman ovulates, testosterone levels go up. And that's why women often say that around mid-cycle they're actually feeling more sexually aroused and interested.
Other hormones go up then too, but Professor Davis believes it's that testosterone spike that helps drive the feeling of female libido.
So with respect to sexuality in women, testosterone has effects in the brain, sexual thoughts, fantasies, motivation. But what is often not recognised is testosterone is a blood vessel dilator. So it in fact dilates blood vessels in the genital area and increases the capacity for a woman to have an orgasm simply by blood flow.
But as I've just discovered, on average by our 40s, we have half the testosterone we had in our 20s. In some women, it doesn't cause much in the way of symptoms. In others, it can make a big difference.
In this setting, what I would do is suggest a trial of testosterone. And the reason I say a trial is because it doesn't fix the issue for everyone.
Oh, it's a cream.
It's a cream.
Okay, and what are the risks of side effects? I think
Well-
that's what most people would worry about, popping muscles and talking like this.
The reason I monitor your blood levels is I want to know if in error you're overusing it. But if your level remains in the normal female range, you will not have side effects.
Well, it will take a few weeks to find out if it helps, so I'll let you know how I get on. In the most G-rated way, of course. It's not surprising I'm hitting a few libido speed bumps as I'm already halfway through my potential sex life. But even when we're young and just starting out, some women's sex drive never even gets into first gear. They hit a roadblock. It's called the pill.
I gather a few of you are on the pill.
Yeah,
Is that right?
Yes.
When did you first start thinking about taking it? How old were you?
I was 16, I think. It was when my skin started breaking out.
Oh, right. Yeah.
My mum got me on it when I was 15 because I had really irregular periods. So.
Oh, right. Okay. Do any of you ever hear that the pill, in some women, can affect your enjoyment of sex, your libido?
I haven't heard that.
No, I've never heard that. No.
It is in the list of side effects, but easily missed.
I just can't believe the doctor never mentioned that. That's not something I've ever really thought about.
Yeah.
No,
It's
yeah.
obviously, I presume it's not been an issue. Yeah.
Must be.
Well, most women like their contraceptive pill and actually prefer to be on the pill than even have a natural cycle, but there's definitely a significant minority of women who completely lose their sex drive when they go on the contraceptive pill.
Completely lose it.
Completely lose it.
Really? So this side effect, possible side effect, has been known about for a long time.
Yes.
And still the message isn't getting out there.
Yes, but we're talking about a taboo subject here.
For some young women, it's a problem right from the start. Though if they've started the pill young, they may never know the difference.
Like, how would you know? Like, the girls, like, we don't get an erection like, you know, the men, guys do. So we wouldn't know if we're suffering or whether we're not. It's actually happening, I guess. That's the way to put it.
But surprisingly, it can also affect women in their 40s, for whom the pill may have been fine until now, but it's suddenly a problem. As we've seen, with age, testosterone declines. Professor Davis believes this means for some women, the additional impost of the pill gradually becomes too much for their sex drive.
Many women would not know this, no. I think many doctors probably don't think about it too often either, because we tend to think, oh, I've taken that for years, it can't possibly affect me. But our bodies change.
Changing pills can help, but for many, an effective alternative contraception, such as a modern, safe IUD like this, is a recommended option.
I don't think we should go around saying, by the way, if you go on the pill, you're going to have no libido, because the power of suggestion's amazing, and most women won't be affected. However, I think there should be a conversation, and I think that if women are aware that they're not feeling as sexual as they think they should feel, they should go back and speak to their doctor about it.
Of course, there are other roadblocks to young women's desire for sex. One trouble is, many don't even have a good roadmap to their own bodies. The potential problems for girls start here.
An egg cell leaves one of the mother's ovaries in which it has been developing.
With sex education and how we teach, or don't teach, female anatomy.
We can see there's emphasis on the fallopian tubes, the uterus, the ovary, the cervix, but there's one part that's fundamentally missing.
Which is?
Which is the clitoris.
By contrast, the penis is shown in all its detailed anatomical glory. Sex therapist Cindy Darnell is trying to rectify this by publishing the first up-to-date anatomical atlas of arousal. Because the truth is, scientists have discovered the clitoris is huge.
Now that's a clitoris.
So that is a clitoris. So the clitoris, a lot of folk probably don't know this, but the clitoris is somewhere between 11 and 12 centimetres long.
Really?
So it is quite a large organ that spans the entire length of the vulva.
As much of this structure lies internally, it helps to see how it sits in this 3D model. And this is a side view, which shows a clitoris becoming erect.
So we can see that the head has moved. So we've gone from here and it's moved up to here.
It's very similar to the penis.
It's really similar to the penis.
So, how many many people actually know about this incredible anatomy? Well, let's find out.
So can you tell me what that shape is? It looks a bit like a penis. Penis and balls there.
I think I've got one myself.
And do you recognise this shape?
Maybe a flower.
Is it lungs? Kind of looks like the logo for like a GM sort of food company. I think that's the best answer yet.
It's extraordinary to think that the true size and extent of the clitoris was only discovered as recently as 15 years ago. But it's clear word is not yet getting out.
Thought I'd learned what I was going to learn today, but nope. Never stop learning.
And if you don't understand your own anatomy, your chances of enjoyable sex are diminished.
I met a girl, 20, the other day who confessed to me she can't have an orgasm through sex, and she felt terribly guilty.
Most women do not have orgasms from intercourse because, as we've just seen with the clitoris and the anatomy the way it is, the vagina actually doesn't have a lot of nerve endings in it. Most of them are in the clitoris. So it's the equivalent of touching a man's testicles and asking him why he hasn't had an orgasm yet.
And it's not just a lack of knowledge that can suppress female libido. We women face another struggle men don't. For many of us, there seems to be a disconnect between what's happening between the legs and between the ears. In other words, between arousal and desire.
Take a look at this. This is what's called a photoplethysmograph, and it's a way of measuring arousal in the genitals. So there's a little light here which can detect the volume of blood flowing through tissue. Without being too graphic, it's placed in the appropriate area, and scientists can measure to the second what's really going on.
Professor Meredith Chivers pioneered this groundbreaking research on female arousal. She found when men were asked whether they were feeling turned on while watching porn, their answers perfectly matched what the instruments were showing of their physical arousal. But the women were highly variable.
For some women, there's a almost perfect relationship between their physical response and how they feel, and for other women there's a perfect disconnect. One, she's becoming more physically aroused but actually feeling turned off.
It's called non-concordance. So what's the explanation? Well, a big one is probably our double standard culture as we grow up.
I think for a lot of women, their physical sexual responses are something they're not supposed to feel or be in tune with. And especially their genitals, messages have been paired with shame surrounding, for example, menstruation. And so I think for a lot of women, there's been a real barrier in terms of being able to connect with their bodies sexually.
So you've successfully navigated the sex drive of your 20s. You've sorted your contraception and hopefully found your own roadmap to delight. It's full steam ahead. You meet a great guy, pair up, kids, and...
So, ladies, how's your sex life?
Oh my God, who's got the time?
What's the problem?
Pregnancy and lactation produce hormones that suppress libido. And once that's passed, well, there are a few other desire distractors. Tiredness, stress, time, which will resolve eventually. But for some women, unknown to them, there's another factor going on too. This is where testosterone comes back into the story.
For all that we joke about finding time for sex after kids, when the issue becomes really serious, there's a culture of silence, even of shame. And if I had any doubts about how difficult a topic this is for women, they were dispelled after spending 3 months talking to women who'd been through hell before finding a solution, not one of whom was prepared to talk openly on camera.
So I recorded an interview under strict conditions of anonymity and asked an actress to replicate the words and emotions as faithfully as she could. The woman was in her mid-30s when, despite her love for her husband, her sex drive just died.
You know, every now and then I'd say in my head, you know, it's been 6 months, you've got to push yourself. So I would. I'd push myself to do it, but I just didn't enjoy it. I felt nothing. And then I would start to question myself, what's wrong with me? What am I missing as a person, Got to the point where I said to him that he should go and find somebody else because I can't give him what he wants, and I don't want him to be unhappy for the rest of his life.
In many of the couples I get to talk to, it's the problems having intimacy it has a devastating effect on their relationship. Of course, from the male perspective too, a lot of men misinterpret their partner's loss of sex drive or even just pain with sex as she doesn't love me anymore.
For our young woman, things only changed when she was referred to Dr. John Eden for testosterone therapy.
I felt it. I actually felt like having sex. And, I felt better in myself as well, not just, I felt better as a person. And I felt like me again, finally.
When you hear a story like this, it's hard not to be compelled into believing that testosterone works. But one story is not scientific evidence. So what is the evidence?
In the research that we've done, about 60% of women will respond and improve. And responders respond pretty well. About 20% of women experience absolutely no difference. And in fact, about 20% of women get worse. And the reason they get worse is testosterone has nothing to do with their problem, and their problem's just perpetuating and increasing. So if the relationship's sour, I can't fix that with hormones.
But while doctors Davis and Eden are convinced testosterone works, other experts are far more sceptical.
Well, my take is it's highly overrated in women for libido. I think that there's not really an entity of testosterone deficiency in women. If you look at the time when women's sexual function declines, it's mostly at menopause, and at that time the sexual function decline is not at all related to changes in testosterone, it's all related to changes in estrogen.
Estrogen is, of course, vitally related to sexual function, particularly through maintaining vaginal tissues and lubrication. Long-term studies have shown hormone replacement therapy helps maintain sexual function later in life. But Professor Stuckey is less convinced by the studies on testosterone.
The question is, in the controlled trials, testosterone versus placebo, was there clear evidence that testosterone improves libido in women? And I don't think there is clear evidence.
And this divide in medical opinion is one of the reasons many doctors don't mention testosterone. Because the truth is, testosterone for women has been deeply controversial. Back when I first reported on this 10 years ago, there were fears that this would happen. That the big pharmaceutical companies would push an unnecessary and ineffective drug onto women.
I think there's a real concern that ordinary sexual lives will be portrayed as if they're somehow not good enough. That women with very ordinary fluctuations in desire, women in long-term relationships where desire clearly changes, will be portrayed, will feel as if maybe there's something wrong with them.
Another concern is the potential that testosterone could pose unknown long-term health risks. The longest trial to date lasted just 3 years and was run by a pharmaceutical company.
This is the debate. How much more satisfying sex is worth the risk of the potential side effects? And in a sense, that decision may be the sort of decision that individual women and their partners make.
But in the meantime, Professor Sue Davis has spent the last 15 years trying to address these valid concerns through ongoing research.
So unfortunately, we don't have long-term studies that are being conducted to say absolutely, categorically, black and white, that if a woman uses testosterone, it will not change any risk. However, having said that, we have what we call observational studies that are incredibly reassuring.
No problem with developing any extra body hair?
No. We did a 20-year follow-up observational study and found there was no increased risk of breast cancer in the 20-year follow-up.
But what if women have plenty of desire, just not for their partners? Is the real problem not medical, but monogamy? Well, I'm about to meet a man who argues, controversially, that long-term relationships are even more of a libido killer for women than for men.
Neither men nor women are particularly well suited to monogamy. That the idea that women are somehow better suited really is a myth, particularly a comforting myth to men, a comforting myth for society, because it casts women as a kind of stabilizing force. Now, is the libido for women even less well suited to monogamy? I think there's some evidence for this.
Exhibit 1. He cites a German study of committed couples which found desire drops off much faster in women than men. Then there's this Australian study of menopausal women that found the way to restore their sex drive was a new relationship.
New partner trumps hormones predictably, consistently, and again, it's just shifting our expectations.
But perhaps the cultural concept that angers Bergner most is that all women want is intimacy, that desire is sparked by doing the dishes, and intimacy and closeness will fuel lust.
The idea that building better communication and intimacy is going to spark lust is, I think, worse than misleading because it leads to real disappointment. Hey, we're having these great conversations, we're doing all the exercises, but nothing's really happening for me. But that spark, I think, depends on a level of distance, a level of seeing oneself as other, as separate. Hence, right now, I live 6 blocks away from my long-term girlfriend, and I'm hoping that will do the trick.
Well, I'm not convinced by Daniel. There's enough evidence to say that monogamy is any worse for women's desire than it is for men's. But the truth is, long-term relationships are a challenge for libido. So what's the answer?
Well, some choose dalliance, others to live apart, many follow serial monogamy. But what about the people who want to maintain a happy sex life with their long-term love? Well, for the last stop in our sex drive, I want to turn to one of Australia's best-known sex therapists, Dr. Rosie King.
I think the difficulty is that people don't understand what happens when relationships mature, because when they come and see me, what they want is the passion and the excitement that they experience in the early phase of their relationship. They think that that's something that should go on forever.
It's true love. The trouble is something called limerence. Limerence is like a smattering of magic dust over you and your new beloved. Your brain is actually awash with a potent cocktail of feel-good chemicals, dopamine, noradrenaline.
And it is a form of madness. We are obsessed with our partner. We can't keep our hands off them.
And limerence always, always fades.
Limerence has to fade. Otherwise, we would never get anything done.
And in Rosie's experience, limerence generally fades faster in women than men, which can lead to a toxic cycle where the man starts to pursue the woman for sex.
The more he pursues, the more she distances. The more she distances, the more he pursues. Right, from time to time, he'll get really cranky. Now, her only option, what does she do? She gives mercy sex. It is the sex that you have when you really don't want to have sex. And mercy sex actually reduces libido even further.
So how do you break the cycle and regain at least the glimmer of limerence? Well, firstly, instead of concentrating on things that enhance female libido, Rosie focuses on solving everything that blocks it.
Rosie, it's a very long list.
Yeah, there's a lot of things that will turn down your libido.
Let's see, fatigue, problems with sleep, prescribed medications including antidepressants, antipsychotics, chemotherapy, low testosterone.
Yep. From the physical to the practical to the quality of affection in the relationship, Rosie addresses it all to try and bring the magic back.
You know, I say, when was the last time you had a really frank discussion about what you like during sex and what you don't like during sex? And most couples will say, oh, we've never had that conversation. I say, well, I think now's a good time.
But what if a woman has no libido left as she's got older? She decides she's had enough. She's done with sex. Isn't that her right?
Yes, it is her right to decide not to have sex. However, she needs to realise there'll be consequences, right? It may mean ongoing unhappiness in the relationship.
Unless he has low libido too, which would be perfect.
Then they would be a perfect match.
And so, to my little adventure in the libido stakes. It's been 7 weeks since I started the testosterone treatment. How do I feel it's gone?
Look, it is subtle, but I think that the testosterone has helped me. I feel like it's given me back a sensitivity and a responsiveness that I had lost, and that is quite a big deal for me. So I've decided that I am staying with it for now.
This is a very personal decision, and I'm aware there's still a question about long-term health risks, but no one should even consider a controversial treatment like this without full discussion of the risks and benefits with a medical professional. So we've navigated a range of tips for keeping the female sex drive serviced through life. You can try a hormone top-up, refresh your relationship, or even trade it in. But even the best maintained libido will start to wear with age. Still, age 70, 50% of Australian women remain sexually active. So if you're still enjoying the ride, I guess just keep on driving.